Good afternoon, my name is Alyssa Hislop, and this policy brief is directed towards management and educational leaders in both acute care and community settings. I'm here to present to you today about the evolving use and benefits of silver-based dressings in chronic wound care. More specifically, I'm here to convince you that with policy development and improved guidelines, appropriate use of silver-based dressings are a promising remedy to improve patient outcomes and provide overall financial benefits. It is no secret that the population is aging and the rate of comorbidities are on the rise. This is showing a direct correlation to the increasing number of chronic wounds. Chronic wounds are a hindrance to quality of life, are requiring patients to access frequent medical care, and are putting patients at risk of serious complications such as sepsis, amputations, and death. Estimated national costs are exceeding $1 billion annually, therefore having a marked impact on the healthcare budget. So what is deterring these wounds from healing? Well, in recent evidence, the term biofilm has become well known. This is a type of local infection where bacteria form and colonize in the wound bed. The bacteria grouping is encapsulated in a unique coating that acts as a strong defense system, protecting it from both the host and the environment. Ultimately, conventional type dressings that we are used to using, such as plain gauze, iodines, or packings, become completely ineffective. Its defense is so strong it even hinders the benefit to antibiotic use. The evidence shows that 80% of chronic wounds contain biofilm, which is leading to these delays and complications in the healing process. In a literature review conducted by myself and another colleague, we conclude with significant evidence that silver-based dressings are effective in promoting faster healing of chronic wounds with very minimal risk for adverse effects. They are applied directly to the wound base to effectively control moisture, exudate, and oxygenation, and most importantly, to penetrate and break down biofilms. They are also proven to reduce the frequency of dressing changes needed, they shorten hospital stays, and they decrease the workload and clinician time spent on wound care, correlating to significant financial savings. The challenge that presents now is not a lack of product availability, it is a lack of guidance on utilization. I implore the need for wound care algorithms or policy guidelines to be developed and implemented into practice to better assist nurses and practitioners in treatment selection. Recommendations in the literature are quite simple. They suggest faster application of silver products once a wound shows stalls to the healing process or when a local infection or biofilm is suspected. Once implemented, a 2-week challenge would give adequate time for the practitioner to assess the effectiveness of the silver treatment and decide then on continuing or choosing an alternative therapy. Chronic wounds are a growing challenge with detrimental effects to our patients and our healthcare system. Silver-based dressings are an available tool that remain underutilized, yet have the ability to significantly improve patient healing and provide positive economic impacts. With these few simple recommendations, supportive tools such as algorithms or guidelines need to be available to healthcare professionals to ensure early selection of appropriate treatment. This in turn will reduce financial costs and reduce health complications for our patients.